Good evening, everyone. Wynn Brown here with the Haywood Healthcare COVID-19 evening update for Tuesday, April 1st. First, I'm going to go right to the numbers so you know where we are in our region. To date, we have tested 509 individuals, inpatient and outpatient. 249 of those have come back with no virus detected or what we would consider negative. We are up to 42 positive in our community. So you can, if you watch these updates on a regular basis, even over the past couple of days, you can see how the numbers are climbing in our region. We have a 14.4% positive rate at this point in time, which is higher than the state average. Again, our numbers are smaller than the state, so they move a little bit. But again, just a call to action to stay home, not go out, really good hand hygiene. It's just very, very important. I mean, I think people are more worried sometimes about the urban areas, but the virus is here in our region, and we had our first death early this morning as well. So that should be a clarion call to everybody. So I just urge you all to play your part to help flatten that curve. On the inpatient side at Haywood, we have 4 positive patients in-house and 8 patients under investigation, meaning we're waiting for their lab results to come back. A note on x-ray, anybody who's coming to Haywood for an x-ray should register right in the main lobby where we now have a registrar set up. And x-rays can be taken right close by in the walk-ins area as well, so in our MAB x-ray suite. So please be aware of that. And just a note from our friends at Clinical and Support Options, our behavioral health service partners on the Athol campus. You can be seen immediately pretty much to see someone to speak to. You just need to call Barbara Doyle and go upstairs on the Athol campus, and she will make sure that someone sees you if you need some support, counseling, and someone to talk to. And that, even though that's not just for the Athol campus, that is really for anybody in the Haywood family. So a great shout out to CSO for supporting us. It's just amazing. Just for radiology, a message went out to the community today, letting them know that they are extending their in-house hours before we go to nighttime service till 10 p.m. because we have a number of volunteer medical staff working in the hospital. And we'll see even more of that coming up, and so they need to be supported. And so thank you very much to our radiology group for doing that. And just some words of comfort, you know, when we put the word out today that we had our first patient pass from COVID-19, outpouring of remarks on our videos. So I'm just going to read a few to let our staff know how much the community is supporting us. First from Mummy Quinn. I'm sorry to hear that your family has lost a loved one, but you and your staff need to always remember that you're doing the best you can. Some things are just out of our hands, but my prayers go out to everyone and their families that has COVID, and my family hope that you all have the best, and we send you our prayers and love. From Eric Navala, praying for you guys and the families who have lost loved ones. God bless, you're doing an awesome job. Thank you. From Amy Doucette, so sorry for those who have lost a loved one and to the medical staff. We know that death is happening all over the world from this virus, and I want to thank the staff that continues despite the difficulty. And then lastly, from Patty Leonard, I just want to say kudos to Bill in EVS. I watched him come into the CT waiting room every afternoon and disinfect and wash down the chairs and tables. This young man has done a very thorough, detailed job. I noticed some others don't always work as hard as he does, and he deserves a social distance pat on the back. Just saying. Nice to see young workers really care about the job they do. It's important and so appreciated, and I told him so. Every one of us can make a difference. And I think that's a great closing note, that we should first thank EVS for the yeoman's work that they're doing to keep our facilities clean and safe, and that every one of us makes a difference, not only at Haywood Hospital, but also in Athol Hospital and the medical group and the Quabbin Retreat, but also all of us in the community who have to play our role and are doing that role very well by staying home and helping us make sure that the disease spread lessens in our community so that we can handle it. So everybody have a great evening. Spend some time with your family. If you're at work tonight, please accept my thanks for the great work that you're doing. And I'll talk to you tomorrow morning and give you an update to let you know how the night went. Thank you for all you're doing as we continue our journey to be one of the best community-owned health systems in America. Good night.